Hi guys, after the little chat about cannulas and needles on tear trough, it triggered a really good question which is relevant no matter which instrument you use, which is what do you do about edema that occurs underneath the eye after having a tear trough procedure. So firstly I would say about this is that we should kind of think about the context, which is that sometimes it can happen immediately and sometimes it can happen literally 2 years after the procedure, and your management is different in those two cases. So think about how long it's been since the procedure happened in terms of diagnosing what to do, because it's really common if you've just had the procedure done that even up to a week afterwards you might have puffiness that's about to settle, and it just doesn't as quickly as in most cases. So for many people there's nothing. You do the procedure, they get exactly what they want, and everyone's happy and off they go. But some people it gets puffy after the procedure, and it can be that way for up to a week. So I wouldn't rush into being heavy-handed right at the beginning with kind of reversing and massaging. Just let things settle. That's particularly true if there's a bruise, because bruising always causes swelling. So lumpiness after filler treatment where there's been a bruise in that area is quite often just a recovery process. It's basically called induration, and it's a healing process that can cause a little bit of lumpiness anywhere on the face, but it's really noticeable on tear trough. The reason this happens with tear trough is because you're so superficial. So it's the thinnest skin in the body. Just move that way, that light. And that means that the smallest little bit of imperfection is really easy to see. So that's why it happens. 0.2, and this is also useful to explain to patients so they know what's happened. So it might be 0.2 of a millimeter thick here, and just in your cheek it gets to about 2 millimeters. So there's a really big difference there, and it means you can't escape from little imperfections. So a little bit of swelling, a little bit of bruising, a little bit of puffiness after the procedure, basically really normal. The problem is when it persists, and you need to be able to give an explanation to your patients about why it persists, and you need to be able to give them a route out of that problem that gives them some certainty, because it's quite upsetting, let's be honest. You have a procedure to try and make yourself look better, and instead you get puffiness and you look tighter, or like you've been up all night. It's not great. So they need some certainty. So a route out of that, even if you don't go rushing into higher layers straight away, you need to at least paint the picture, which is what I'm going to do for you today about how I would manage periorbital edema or tear trough puffiness after a procedure. So first thing is, as I said, explain it, what's causing it. Can be swelling, can be inflammation, can be allergic reaction. That's usually much more obvious, like a reaction, and it involves erythema that seems to persist. Most commonly it's just basically a little bit of water attraction that seems to make the filler. That's because the filler pulls a bit of moisture, or because the filler reduces flow of fluid outside of the area. These are the two theories. It's really hard to tell which one's actually happening, but if you consider that there are various lymph nodes in your tissue and the lymphatic drainage happens through the cheek, and you put a filler on top of that area, it might just slow down how quickly that fluid can leave. That's one of the theories you also hear mentioned. So what do we do about it? First thing is, let's be practical. Let's assume, by the way, that this is none of the complications like reaction or infection or bruising. This is a settled case. There's nothing else going on, but there's still some puffiness. What do we do about it? Step one, tell the patient the plan, which is there are basically a series of options. You can massage it. That will solve on the day, maybe up to half of cases I can sometimes solve fairly quickly with a massage. Those are the milder ones. Step two is that they can massage themselves when they go home, so they could do exactly what you did for them. They can do that on themselves, but you should show them how to, and I'm going to show you how to do that on a model. It is literally a model, by the way. It's not a real person. And then stage three is you can higher laser. So what's the route that you go on? Obviously a lot of people don't like going straight into higher lasing because you lose what you've done. They may even be quite happy with it. It might just be a little bit puffy. But they kind of can really see the benefit, and they don't want to go back to zero and then try again. So those are the options. I say half of them you can solve on the day. Half of what's left you might be able to solve with them massaging at home, and then the others you need to higher laser, unfortunately, and start again. So here's my little technique that I do with higher lasing. So I'm just going to see if I can put this tripod down, and then you can see Debbie. There she is, Debbie. So Debbie had her tear trough treated, let's say 2 months ago. And what I'm getting at now is a little bit of arnica gel. So it doesn't have to be arnica gel, it's anything slippery is absolutely fine. So 2 months after the procedure, she notices, and it could be 2 weeks after the procedure, but basically the puffiness starts, and it's usually worse in the morning, and then it persists all day long, and there's no tenderness, and there's no erythema, and there's nothing else that you can think of that might be causing it. She doesn't have a sinus infection, she doesn't have a dental, you know, all the other things that might cause inflammation in that area. So all we have, essentially the only thing that we have with Debbie is a little bit of puffiness and a lower lid and nothing else. And this is also, by the way, part of your examination, because when you're actually doing this, you're going to get feedback from the process of massaging it, and that will tell you if there's a little bit of inflammation, because as soon as you start massaging, the patient goes, oh, that's really tender, that's an indication that there's inflammation, and it might be worth waiting a little bit longer. I still normally massage it, but just don't go into high lasing if there's still tenderness, because there might basically be some inflammation that will settle in a week or two's time. By the way, this model's name really is Debbie. Debbie was the guy who makes these models. His mom was called Debbie, and that is actually her face, so we all call her Debbie. It's not a name we've come up with in the building, but we used to have a Debbie who worked with us, and it caused us a lot of confusion when we were looking for Debbie, because Debbie gets moved around by everyone. So anyway, this is the fake Debbie. Okay, let's have a look at what I would do in terms of massage technique. I hope you can see this well. So a little bit of arnica gel each side, and I put that arnica on my thumbs in particular, so it's nice and slippery. And then I'm basically, with the patient's eyes closed, you're massaging down and out, and this is following the lymphatic drainage, so the lymph nodes basically run down here and drain into the cheek. And because we've got this thick cheek tissue, which is 10 times thicker than the eyelid tissue, I should be able to hide some of this fluid. Now, it's hard to get a sense of how hard I'm pushing, but this is firm and slow, and you're it's basically a gel that's woven in with the other tissues, so it's quite important to be quite firm and slow to give it a chance to kind of squeeze out. And it's going to squeeze some of the product out, but it won't take all of it out. And you basically do this for 3 to 5 minutes, and you're looking at the area as you do it, and quite often it's quite an instant and obvious response that you're down and into the cheek. And of course, I'm also explaining at this time, this is what you can do at home. You can use some moisturizer, anything that's slippery basically, and just try and squeeze it down and out into your cheek. And I am squeezing really quite firmly. This is not a gentle massage. This is not relaxing. They often feel a little bit uncomfortable, but it's making good progress. And I would then stop all the way out, lateral. I'll stop and have a look. Now, you'll get an instant response from that as well, because you're squeezing fluid out, and you're hoping that you've taken some fluid, some filler, and then it might rebound afterwards. So as I said, half of them are going to rebound. They should then repeat that at home. Make an appointment at this time to see them again, so I get them back in maybe 2 weeks' time, and at that time you'd be planning to reverse it if it's still making them unhappy. So, and reversing is pretty easy. You often get a result within an hour or two. This massage basically is also much better to do in the early stages of the problem. So if they've just had a treatment, 2 weeks later they got puffiness, you've got a chance of doing it in one go. If it's been puffy or it's like that for 3-4 months after the procedure, there's a bit less chance you'll be able to do it with one massage. It might take a bit longer. And then if it's happened 2 years afterwards, basically the filler breaking down causing edema, you might still make a difference, but for those ones I'm a bit more certain that they're going to need high laser and it'll make a difference quicker. So that's about it. When you're going to high laser, if it's an old product, and there are a few people around like this, I've seen someone who had their tear trough treated 4 or 5 years before they came back with puffiness, and that worked instantly. Put a little bit of high laser in and it just disappeared. It was like almost quite frightening, because she had quite big eye bags, and they just went really quickly. So you might get that when the filler is older. I think it's kind of part of the breakdown process of older fillers that they attract a bit more moisture. So anyway, I hope that helps. Thank you for watching. Just noticed Debbie, you've been watching all along and I've been talking about Debbie. That's what made me think I'd clarify why we've called her Debbie. It's a real Debbie. Hi, it's okay. Come and say hello if you want to be on live. There's Dr. Ahmed's just come in. We're just talking about. He's running a training course.
Sorry.
It's okay.
I'm just
see you later.
consenting.
Okay. Yeah, they're running. The cheeks and lips you're doing today. Foundation.
No. Today is I'm supervising a delegate.
Oh, okay.
Who's done courses with us, but she's come back bringing someone she's treated.
Right. Yeah, the first one of those. So we're starting a new thing where you can bring your own patients back and work under supervision. So I'm going to use that to plug that. What a great idea! Yeah. So if you anyone watching this who wants to get more experience with a difficult patient and you want one of our doctors to monitor you, do it with you, you can book really short sessions now. It's a new thing that we're trying, seeing how well it works. Because obviously it's logistically interesting, but I don't know. I'll have to click on your face and look closer. I think you're much more beautiful than this Debbie. She's kind of she's a bit scary when she sits in the corner of the room with only half a head. Anyway, I hope that helped everyone. Once again, if you found that useful, tag someone who might find it useful. Share it. Comments are great. I love reading through the comments, and of course ask me more questions because I'm using these questions to create the next day's videos, and we're getting a nice kind of theme of who's asking and little kind of top ups of information. So I really hope that helps, and hopefully I will see you all on tomorrow. Thanks, Adam. Adam has requested that I do some banter, but I'm not the director of banter in this building. Adam Chong is, so I'll be. I'm going to go and find you, Adam, if you're in the building. I'm going to get you on the next live. Thanks for watching, everyone. I'll see you all probably tomorrow.